Behind me is ground zero, where our paramedic students are helping all our patients. These patients will then be handed over to the field hospital, where the student nurses will also be taking part in the field hospital section of the simulation.
Well, this is day 2 of our Alien Invasion, our major incident simulation event. We have got our final year nursing students coming through to practice their patient assessment skills, their emergency triage skills.
Today we've been doing our major incident simulation under the guise of a pretend alien invasion.
We've set it up so they've got quite accurate illnesses and conditions, their blood pressure, all that kind of thing is accurate as to how it would be if it was a real life patient. And so the nurses from UHD are supporting our students to understand how to treat that patient and treat them as though they were a real life patient in the hospital.
I'm a clinical educator at University Hospital Dorset Trust. I've come down today to help facilitate the simulation event, which is fantastic. It's something I didn't have when I was a student nurse, and so I've just been helping them run through these A to E scenarios. So our A to E assessment skills have been assessed under quite a lot of pressure, noise, so really we're having to think on our feet. Your A to E assessment is really the most important way to assess how unwell a patient is and to look at different treatment options. So it's something that the doctors will use, nurses will use, and it's a way that we can communicate with multidisciplinary team to look at treatment options for the patient.
So today we've been treating a variety of injuries. They've been treating fractures, open fractures, shrapnel injuries. They've been treating internal hemorrhages and basically trying to encourage them to look at a patient as a whole rather than what they can see in front of them.
As we do it day to day in real life, it's quite nice to see how far we've come as nurses from students.
So we've got our mental health nursing students here today. They are set up to support someone who is experiencing a psychotic or manic episode. That's for them to assess. They will have 3 different stations that they experience. So one is meeting a person who is unwell, who we have our fabulous actor, Hannah, who is portraying the character of someone called Alex. Our students then have to assess for risk and mental state. They then move into a station which is about gathering clinical history, backgrounds, which they would do in practice to understand what's going on for this person, what's their medical history, how they presented before. And then our final station is Alex's bedroom. And the students have to rummage around and see what they find. So for example, we've got all kind of mysterious things hidden in there which might support the diagnosis of the person or contradict it. And once our students have explored all those 3 stations, they then come together and decide what's happened, what are the risks, what is our person presenting with, and what is their care plan.
Yeah, I think it's good because when you're at university and have simulations, you know you're in a classroom and it feels quite safe and it doesn't feel very real.
And it just helps us recognise that this kind of situation can happen anywhere, how we would deal with it, stay calm and to go through our training in our head. Yeah, it's just been helpful to put that into practice.
So I think it's good because if we do face somebody in the public that are like that, it sort of gives you experiences and skills to how to interact with them and things like that. So yeah, it's really good.
To some of the actors, they've had very realistic injuries. They played the part extremely well, and it was just like having a real patient. Having the noise, the environment, that element of chaos, which you wouldn't get in simulation normally when you're using rubber mannequins. So it adds that whole new depth and realism to it. So it's a really nice way for them to get to speak to people that are actually working as qualified professionals at the hospital and look at different options for them in their future career.